Shortly.
Please remember to mute your line if you haven't already, as upon entry, you're not muted.
Let me just see. It looks like everybody's connected. So we're going to go ahead and get started. So this is our South Dakota Project Firstline office hours for September 2024. We are pleased to have you join us with today. Our office hours features a different topic every month, and it's a time for like-minded individuals to get together, talk about our infection prevention questions, share stories, and learn from each other. So a couple reminders before we get started. Please feel free to submit questions in the comments. We encourage you to share comments, resources, and links, and recording is going to be shared after the event. It goes on our STFMC and Project Firstline webpage and on YouTube. Please complete the survey at the end of the event. It helps us so much, and we greatly appreciate your feedback and any topics that you might want to cover. We're happy to take those into consideration and cover them. And Project Firstline is the CDC's national training collaboration for healthcare infection control. The South Dakota Department of Health has contracted South Dakota Foundation for Medical Care to bring you South Dakota Project Firstline. So let's meet our team. So I'll let Jess go first.
Hi, everyone. My name is Jess Danko. I am a program director at SDFMC and assist with South Dakota Project Firstline. My background is respiratory therapy, healthcare administration, and I am a long-term care certified infection preventionist.
Rebecca's not here with us today, but she is our Project Firstline team lead for South Dakota. She's an RN and an LTC CIP. Valerie, go ahead.
Yep, I'm Valerie Wagner, and I'm a Master of Nursing Science in Nursing Education with Certification Public Health Nursing. And I am a team member with Project Firstline.
Renee.
Renee Robbins. I'm a registered respiratory therapist and program manager with South Dakota Foundation for Medical Care, working on South Dakota Project Firstline and Dementia Dialogues training.
Perfect. And I'm Jamie Rogenbauer. I'm a team member with the South Dakota Project Firstline. I've got a master's in public health, and I've been with the team for maybe 6 months. And then the rest of my time I spend with the Ryan White HIV Project. So let's get started on our topic for this month. Valerie, take it away.
Yeah, as Jamie said, we're going to talk and touch on skin. And our today's objectives, we really want you just to understand that germs live on the skin. And we want you to know where germs live in order to help stop spread and protect your patients and your family and your friends. And we also want to discuss how to reduce your risk. So the CDC offers these graphics through the Project Firstline, and a lot of this information here comes right from that, with that link with germs live on the skin. You are free to download that and post that in your workplace as need be. Next slide. So where the germs live, obviously with the skin is the largest organ in your body, and your human body is full of reservoirs and different places where it can live. Next slide. So humans of all ages have hundreds of millions of germs that live on our skin. Germs on our skin, especially our hands, can get onto surfaces and other people, including your patients. So germs that live on the skin, we focus on the Staphylococcus aureus, which is commonly known as staph, including the MRSA, which is that methylation. I can't always pronounce the resistant staph. Streptococcus, which is often commonly known as strep, and the candida, including the C. aureus. Germs that spread through touch Like we said, our hands are our tools. And as we mentioned, hands can spread germs. So many germs grow on healthy skin, and germs on the skin can get onto surfaces, other people, and things that will touch other people. The skin, especially again your hands, carries many germs and spreads them easily. When one's hands touch the surfaces, germs can spread from surfaces to that of the people or to others. Next slide, please. Okay, so germs that spread through the skin sometimes happens through healthcare tasks. When we break through their body's defenses through breaking through the skin, that is often, a task that we as nurses do have to encounter. So a lot of times those tasks can include putting in an IV, drawing blood, surgery, or trauma. It creates that pathway for those germs to spread into the body. So healthcare tasks that involve the skin, again, anything that involves touch, needle sticks, injections, IVs, surgery. We really want to recognize the risk. Recognize where germs live in healthcare is the first step to understanding how to stop their spread. The right infection control actions that you do every day with every task, with every patient, is the right infection control to help stopping those spreading of the germs. So the best way on the next slide to reduce your risk, obviously hand hygiene. Hand hygiene is the #1 way to reducing your risk and for the risk of others. Soap and water, or the healthcare grade alcohol-based hand sanitizer, using according to the situation. Obviously, the CDC highly recommends the alcohol-based hand sanitizer, but for some situations, you need to use soap and water as well. Appropriate glove use, you want to make sure that they fit properly. You don't want a glove that is too big or too small, with the risk of tearing. The cleaning and disinfection, you want to make sure that you're utilizing those healthcare grade EPA approved cleaning products for that disinfection, and knowing each product's contact time, dwell time, how long does it need to stay wet to disinfect.
I just want to add to that hand hygiene and glove use really go together. So even before we put our gloves on, we need to be doing proper hand hygiene, because if we don't, then we're touching those clean gloves with our dirty hands, and we're potentially making all of those clean things dirty as well. So we have to do proper hand hygiene before and after we put on our gloves. Just wanted to add that, Val.
Absolutely. No, that's great, Jamie. Thank you. Any questions or comments for the team? Again, feel free to put it in the chat if you're comfortable that way. Again, your feedback is valuable. So if you can please right now scan this QR code and complete the training evaluation, we would greatly thank you for that. South Dakota Project Firstline, as a reminder, we have our website. Please, we've got tons of utilize the resources that are there. They're there for your benefit. The infection prevention training that's there is free. If you know people in the dental field or in the EMS, there are credits available for them as well.
And we really want to know what you want to know. So if there's something specific in your clinic or your nursing home or something like that that you want covered with your team, let us know and we can put together a presentation really for you. So.
Absolutely. We can do it in person or virtually.
And we'll stay on for any questions that you guys have. Otherwise, we will wrap it up.
All right, I don't see anything coming into chat, so that will conclude our office hours for today. Thank you guys all for joining us. Please take a couple minutes to fill out that survey and really give us some of your feedback on what you would like to see during office hours. Have a good day. Thanks for joining.